In this video, I'm going to go through the recovery from a Fleur-de-Lis abdominoplasty. So that's the abdominoplasty that is up and down and across the side. It can have suction-assisted lipectomy, it can have hernia repair, can have diastasis recti repair as part of it as well. Before I start though, it's very important that you're aware that all surgeries have complications. So there is a video about complications. I have a link to that down the bottom in the description, or there should be a card here with the video on it. Recovery process is really important to understand before you get into it. And I think the other thing to understand is that you can actually affect the way that you recover from the surgery by preparing beforehand. I think that's a really important understanding that you should have going into these operations, because all of these operations, like the Fleur-de-Lis, the body contouring surgeries, they are big operations, they're long operations. There is a significant recovery period, and the fitter you are, the healthier you are, the better nutrition you have, the better you're going to be able to cope with that strain on the body recovering from the operation. So that's really important to understand. Make sure this video is just educational content for mainly my patients, because there's things that I do that are quite different from other surgeons and what they do. I have quite a bit of an intense follow-up period after the surgery, and I see you regularly as well after the surgery. What does a realistic recovery look like from a Fleur-de-Lis abdominoplasty? From the hospital day one to getting back to normal 3 to 6 months down the track. I'll share the typical milestones and what you need to know to optimize this healing process, and what you can expect at each of these stages of the recovery process. Overview of the procedure first of all. There are other videos that I go through a lot more in detail about the Fleur-de-Lis abdominoplasty. First of all, why the Fleur-de-Lis abdominoplasty? It treats the horizontal excess as well as the vertical excess of skin. So you will have a cut in the middle, cut down the bottom. If we're just doing loose skin, so if you're a BMI, let's say 20-25 with very minimal fat, then the operation probably takes about 3.5 hours. If you are a little bit bigger, say 25 to 30 BMI, may have a little bit more fat on you, and we're doing suction-assisted lipectomy, then you may find that it takes 4.5 hours. Then there are other abdominal wall things that we can do. So if you have hernias, for example, inguinal, epigastric, umbilical, ventral, incisional, we can fix those, but they add to the time of the operation, also add to the recovery period that it will take. So if we're doing suction-assisted lipectomy, Fleur-de-Lis, hernia repair, diastasis recti repair, the operation may take up to 5 hours to do. So all of the additional operation things that we do will add to the recovery and will also add to the operating time. And the operating time, the longer that is, the more likely it is that you will have blood pressure issues, more pain, issues afterwards. The immediate goal of the recovery is obviously pain relief, early mobilization, and monitoring of any sort of complications that you have. The key one that is the early complication would be if you had a bleed, and we have to take you urgently back to the operating theater. The recovery can be challenging after a weight loss. The key thing there is that after weight loss and the skin quality is pretty poor, most of my patients are post-bariatric surgery. I certainly get a lot more patients that are on the medication treatments for weight loss now as well. More or less the same sort of things apply. The nutritional state is going to be something really important that we look at. Are you having enough protein? Are you having enough vitamins? Do the screening test beforehand to make sure that all of that is optimized. Do you have anemia, iron deficiency beforehand? That has to be corrected before we do the operation. Any previous history or DVTs. Smoking is really bad. It will interfere with the healing. It triples the complication rates. Very high rate of breakdowns, issues after smoking, anesthetic problems. I recommend 6 weeks before the operation to stop and then 6 weeks after. And obviously, ideally stop completely, but that is definitely a very, very important thing that you can do to optimize your recovery. The other thing is that there is going to be some mood fluctuations after the surgery. You're going to have pain, you're going to have discomfort, you're going to look at your tummy, you're going to have big scars initially, there's going to be dressings, there's going to be a compression garment, you're going to have pain getting out of bed. So you have to mentally prepare for that as well, and maybe have some support at home for that as well. So let's have a look at some common milestones and also key concepts of recovery. So I'm going to go through these step by step so that you have a really key understanding of what to expect. So obviously, first day, you're having your surgery. So you might have a 4-hour surgery, 6-hour surgery, and a lot of the times I combine other procedures with it. So you might have a breast lift, mastopexy, brachioplasty, thighplasty, or something else with that operation as well. So it may be an 8-10 hour operation. The first day, which is the day after your surgery, is going to be a little bit tough. You usually will have a pain button, so when you press it, you get pain relief. You'll have underlying pain relief as well. You will have on your calf, you'll have a little squeezy calf machine that squeezes your calf to try to prevent the DVTs, or deep vein thrombosis. You'll have what's called TED stockings, which are on your calves to try to, again, prevent DVTs. You'll get blood thinning medications for DVT prevention as well. So we try to do everything we can to prevent DVTs. Why are we worried about that? Because DVTs, clots in the leg, may then become a pulmonary emboli, a clot that goes from your leg into your lung, and that can be a very serious problem. So that's a key prevention measure in the first day. Getting you up out of bed the first day is also really important, but especially if you've had a really long operation, you will find that a lot of patients get blood pressure issues, so they get low blood pressure, they get dizzy when they get out of bed. So first day, sometimes you don't actually get out of bed, so that's something to consider as well. You will have an IDC, or indwelling catheter, for your urine, so you may be okay from there. Obviously, a lot of times you'll be constipated, so first day you're not going to go to the toilet anyway. We give you something for the constipation as well, to try to use preventative measures for that as well. You will have a compression garment, so there will be a garment that goes around your tummy. That stays on for 4 weeks full time and another 2 weeks after that, usually during the daytime. So that is something that you have on, and we put it on before you wake up. You will also have drains. There will be drains coming out from your thigh area. I usually leave those in until day 2 to 4 usually. However, sometimes very rarely they need to stay in for a week, week and a half. We usually take those out when there is 20 cc of fluid in the drain or less. And those drains are in there to try to prevent the seroma and fluid buildup that can happen. They also do help a little bit to monitor for hemorrhage or bleeding, but you can have a blocked drain and hemorrhage, so there's other ways of monitoring that as well. You will have pico dressings, which are the suction dressing. They're white dressing with a little box that suck on the dressing. I've done a separate video on those, and those are really helpful for wound healing as well. Usually, once you're up and about, second day, you'll aim to get you home day 2 to 4. Everyone's a little bit different, and again, the extent of the surgery will determine how long you stay in hospital. Once you go home, you will come into the clinic. So that's an intense period of reviewing dressings, wounds, doing light treatments and other supportive measures for you, and making sure that we monitor complications. Usually you'll come into the rooms 2 to 3 times for the first 2 weeks. So once you're out of hospital, we'll start booking you for your consultations in the office, and that will be me and the nurse that will be monitoring that. So generally you will see the nurse, and if the nurse is concerned about anything, then she will tell me and I'll come and have a look at any issues. Very common to get breakdowns, minor wound infections. The belly button always looks a little bit pussy and red, so we keep a really close eye on that. Day 7, we'll take off the Pico dressing and then replace it with a Hypofix dressing, which is a tape dressing, and you can get that completely wet and have a proper shower, and then after that as well. Now, week 2 to 4, generally, if you have no issues, then you don't need to come into the office. So that means that a lot of our traveling patients that come from Sydney, the North Coast, northern New South Wales, Canberra, there's a lot of patients that I see from far away. They can pretty much go home that 10-day to 2 weeks, and then GP follow-up, and we can do telehealth, Zoom calls, and things like that to keep an eye on it. If you do have a wound breakdown, then we need to obviously keep managing that, and that's usually dressings, wound review, possible antibiotics, something like that. Now, what about driving and work? That really depends on what type of driving, and it also depends on where you need to work. Can you work from home? Do you have to drive to work? Do you have to lift heavy weights? What is it that you need to do at work? So that will determine a little bit of when you can get back to work. If you can work from home, then the determining factor there is how much pain you have and if you need to take the heavy-duty pain relief. If you're taking the heavy-duty pain relief, you shouldn't be working. Usually 10 days to 2 weeks is when you need that heavy-duty pain relief. And then that's, so you're looking, 10 days would be really pushing it a little bit. 2 weeks, most of the time is okay. 2 weeks you can usually drive, so but you're not going to be back to normal. If you can take 4 weeks, that's really the recommended one. But a lot of people want to get back to work ASAP. Some have more leave, so it just really depends on your situation. So 2 weeks for really, really light work. 4 weeks if you need to drive to work, and then do a little bit more. If you're lifting, if you're a mechanic, or if you're like a truck driver or something like that, you may actually have to have a little bit more time than that. Again, everyone is different, and the recovery times do vary a little bit from person to person. I usually do a routine follow-up at week 4, and that's when we take photos, I look at the wound, we discuss silicone sheets, so that's the one, scar prevention management. We can send you the photos at that stage as well. If you are far away again, we can do a Zoom call at that stage. I do recommend that you come in for at least one of the routine follow-ups so that we can do proper photos. All my patients get their photos. We send it off like a Dropbox link, and you get all your photos that we've done throughout the whole process. The other routine follow-up that I do, so we have 1 month, 3, 6 and 12 months follow-up. Generally done in, obviously my room in the clinic in the lawn in Hunter Valley. Again, if you're far away, we can do a telehealth or Zoom call, but ideally you should come for at least one of those follow-ups. If you do have an issue between those follow-ups, you just call us up and we deal with it right there and then. So don't feel like you have to wait for your next follow-up to raise an issue if you got swelling or you got something else that you're concerned about, you got some redness, you got new onset pain, you got something else. Just call, we schedule you in straight away to have a look at that issue and deal with it as much as possible. So that's the routine follow-up. And if we look at another couple of things, which is a scar. Scar will look really red and angry looking up to about 6 months, and then it will start fading. Swelling, you will have worse amount of swelling at 2 weeks after, and then it will gradually come down. At 3 months, it's about 60% less swelling, and then up to about 12 months where all the swelling goes. Let's have a look at a couple of the issues that can happen after your surgery. The Fleur-de-Lis, as I said, is a big operation, so it has a lot of cutting. So there will be from down there to there. Very, very common to get an issue in the T-junction, so that's called the inverted T-junction, that comes together. And that's because the tips of that skin has probably the least amount of blood supply. So it's very, very common to get like a centimeter breakdown or minor little redness, a little bit of a gunky area and things like that. Very common, almost everyone gets that. The other area that is usually a problem area is the belly button area. always looks a bit red, angry, swollen, pussy. Most of the time we just need to do dressings and you need to be patient, and within 6 to 8 weeks it all settles down. Swelling and seromas. Now seroma is one of the most common complications with any body contouring surgery, but especially the Fleur-de-Lis. Anytime we cut anything in the body, we create a space. That space the body wants to fill with fluid, and that's the reason why we put drains in, to drain away the fluid to try to get the tissues to stick together. And then the tissues stick together, then we can take the drains out, it's all healed up. Sometimes the fluid reaccumulates into a lake, and that's called seroma. Then I have to come back, put a needle in the seroma, pull the fluid out, and we have to then probably repeat that usually 4 to 6 times to completely get rid of the seroma. So that's one of the more common, probably in the range of about 10%. Now wounds. Wounds, everyone gets some sort of breakdown, unfortunately, and some sort of issue. We talked about the T-junction, inverted T-junction, but other areas around the belly button, the other areas are very, very common. Most of the time, if you get a wound breakdown, then what I'll do there is I'll dress it for a while, just because initially it's pretty gunky, there's a lot of bacteria there, may smell a bit, so we do dressings, clean it regularly for probably about 2 weeks. And then once it looks nice and clean and dry and has good granulation tissue, I can take it back to the operating theater and just restitch and recut as a day procedure to tidy that up for you. The other thing is irritation and infections. So those again are reasonably common. Oral antibiotics, treatment in the clinic, just watching and making sure it's all settles down on its own. Hematoma. Now hematoma is different from, so you have several different types of hematomas. You can have a little small hematoma, that's a little bump that has bled into the tissues and it's got a lot of bruising, but it's not expanding and it's not very big. So those can probably just settle down on their own. We can observe it and it goes away. If it's a hematoma that's actually actively bleeding, so it's going bigger and bigger and bigger, and that usually happens in within the first 24 hours, that is an emergency, and we have to take you back to operating theater, open everything up, find where it's bleeding from, seal the bleeder, wash everything out, put new drains in, and then obviously you will have a little bit of a delay in your recovery. The bleeding rate, it varies tremendously in the literature. I would say it's probably between 1 to 5% chance of that happening. Then I've already mentioned the DVTs and clots and the pulmonary emboli, so we do a lot of things to try to avoid that. I've started in the last few years to give anyone that has more than 6-hour operation, I'll give them 2 weeks of blood thinning medications, and you inject yourself at home just to minimize that chance of a clot, because again, these are big long operations and the risk is a little bit higher than most other operations. The other thing that is really, really common after surgery is numbness. Numbness in the area that we lifted the skin up, and numbness down the bottom of the abdomen. That numbness most of the time settles, and you'll find that the sensation keeps changing over time as well. So you might have initial numbness, then you might get a bit of tingling, you might get shooting pains as the nerves grow back, you may get hypersensitivity, and you may get all sorts of other things as well. So that's a very, first 3 months, there's a lot of different things that change over that time. Most of the time, 6 months onwards, that sensation has changed, and many times it goes back to normal. Sometimes you do have a little bit of numbness that's still there, even at a year, 2 years after. And very, very rarely can you get sort of chronic pains and things like that from that. Now, if we're doing suction-assisted lipectomy or vasal liposuction or standard liposuction or any of those procedures, then there will usually be numbness in the areas of the liposuction, and there will be also increased swelling in the areas that we've done the liposuction in as well. We got hernia repair, diastasis recti repair, and internal healing. So basically that means that you're going to have a little bit more recovery time, especially if you're doing the diastasis recti and also the hernias. You have to be a little bit more careful with straining and lifting after those operations to prevent complications happening as well. What is the prevention and risk reduction that you can do to make sure that your recovery is the best possible that it can be. I've already mentioned a couple of things. So smoking, for sure, that is one of the biggest contributing factors to complications by far. If you have a chronic health issue like diabetes or some other chronic health issues, make sure that's optimized as much as possible. See your GP, make sure you've got all of that sorted as well. Most bariatric patients, so gastric sleeve bypasses and other things, will have some sort of nutritional deficit. So leading up to the operation, you really want to make sure that your protein intake, micronutrients, vitamin, minerals, everything is optimized for the surgery. Maybe you take protein shakes, see your GP, he can do a nutritional scan. You most likely would have had a dietitian after your surgery. You might want to just have a visit with him or her to have a discussion about your nutrition, just to optimize all that, because that does affect healing, and that's really important consideration beforehand. The other thing is exercise, and I usually recommend exercise that builds muscle. So if you're just doing aerobic exercise, that is good. Obviously, that's good for fitness and aerobic fitness. But if you're building muscle, that's really an excellent way of preparing for surgery. So that's weights. Weights, building muscles, building your core, arms and things will make it easier to get up. Legs will make it easier to get up. So just building your muscle mass will make it a lot better recovery for you. Now, dressings and compression garments, we've already mentioned that, but basically the wear garments full time, we have a whole range of different types of garments. We have the wraparound garment, we have the one that pull up, and sometimes we have to swap those around for your comfort, and sometimes if swelling settles, we can use a different type of garment. So that's something we do in the office as well. So you may find that one doesn't quite fit, the rubs a lot. The other suggestion I have for the wraparound garment is to put a t-shirt on and then put the wraparound garment on top. A lot of patients get rubbing underneath the breasts from the garment and the wraparound, so really important to consideration there. Rest and recovery, so if you're sleeping, usually first few weeks on your back, and then you can probably the first 10 days, 2 weeks, you can go on your side, but make sure you bend your legs so you don't put too much strain on the tummy. I have a couple of questions that are fairly common, so I'll go through them as well. What is the recovery time for Fleur-de-Lis Abdominoplasty? Depends. Again, you can probably say about 2 weeks to get back to most day-to-day stuff around the house, light driving, doing most things, but not heavy exercise or anything like that. 4 to 6 weeks, you should be doing a lot of activities, getting back to light exercise. I usually tell everyone at 3 months, you should be able to do everything you did before the surgery. So that's kind of the time frame there. But again, everyone varies. Depends a little bit on what all those additional surgeries are that we do. Each additional surgery we do, you have to add a little bit more time for recovery. So that's really important. The other question I get is how painful is it? And how does it compare with a C-section? How does it compare with other surgery? Obviously, a lot of patients that I've seen have had gastric sleeves. How does it compare with the recovery from gastric sleeve? Fleur-de-Lis will have more pain than all those operations. There's significantly longer recovery time than those operations. It's a bigger area that we are cutting, significantly bigger incision lines, so you will have more pain than those operations. A gastric sleeve, for example, is laparoscopic. It's usually overnight stay, usually not that terribly painful or difficult to recover from unless you get a complication. C-section may be a few weeks of recovery, but it's only a scar down the bottom. So the Fleur-de-Lis by far will have the biggest recovery from those operations. Are there drains? Yes, absolutely. All my Fleur-de-Lis patients will have drains. There will be 2 drains and they will come out from the thigh area and they stay in for usually about 3 to 4 days. Sometimes a bit longer, sometimes a bit less. It just really depends on how much fluid is coming out of them. How should I prepare? Well, we've gone through that in detail. So make sure you exercise, healthy diet, proper sleep, stop smoking, and don't overdo the alcohol or other recreational drugs and things like that. So, and also have some support at home from your spouse or from friends, from maybe grown-up kids or something like that, just to get you support to get through that initial period of the operation. Now, the Fleur-de-Lis Abdominoplasty versus the Traditional Abdominoplasty. Well, first of all, Traditional Abdominoplasty probably more refers to the extended abdominoplasty post weight loss. The extended or the standard abdominoplasty will pull skin straight down. So if you have horizontal excess, it's not going to fix the issues that you have. And this is particularly important for post-weight loss patients. The Fleur-de-Lis is a significantly bigger operation in that it has a bigger cut and it does have higher complication rates than the traditional abdominoplasty. However, it's all relative. If you are not getting the result you want because we're not cutting excess skin out, then I think it's a serious issue choosing the correct operation. So yes, there is a higher complication rate and there is a higher recovery rate from the Fleur-de-Lis, but you are also treating those areas that you can't really treat with a standard or extended abdominoplasty. So that's something we talk about extensively in the consultation, and something you have to decide which way is the most important thing for you. Let's summarize. It's been a really long video. I hope you found it helpful. Recovery is progressive, and obviously each individual has a different recovery. Early mobilization, garment, nutrition, and regular reviews are really the pillars of recovery. So those are the things that you really need to consider. Complications do occur, unfortunately, and we've gone through quite a few of those, and I have a separate video of complication management and complications after a Fleur-de-Lis abdominoplasty that you need to watch, and there is a video there and we'll put it up here somewhere. And the key thing is that we are here to help you. So the team is here. You can call the office. We can get you in early if there's any issues. We basically take care of you until all those things are settled and you are out on the other side of things. Make sure you book an online consultation. There's an online booking link down the bottom, and I hope to see you in the rooms. This has been Dr. Bernard Beldholm talking about the recovery after a Fleur-de-Lis abdominoplasty, and I'll see you in the next video.